Let's discuss anterior compartment of thigh today. Anterior facial compartment contains various muscles which are sartorius, iliacus, and psoas, which are combined as a combination. They are called iliopsoas, pectineus, and the quadriceps femoris, which includes four different muscles. The blood supply is by femoral artery, and the nerve supply is by femoral nerve. The anterior thigh muscles are the sartorius, this one, the iliopsoas here, this is iliacus, this is psoas, this one is pectineus, and here we can see just the origins of the anterior thigh muscles. In this picture again, we can see various anterior thigh muscles. These are the quadriceps femoris muscles. The quadriceps femoris include rectus femoris, the vastus lateralis, vastus medialis, and this, if we reflect or remove rectus femoris, beneath it is the vastus intermedius. This one, vastus intermedius. Here we can see this is vastus medialis and this is vastus lateralis. The three vasti and the rectus femoris as a whole, they are called the quadriceps femoris, and they have a common insertion on the base of patella here as the ligamentum patelli. The attachments of these muscles, we are going to do these one by one. Let's discuss sartorius here. Sartorius comes from the anterior superior iliac spine, and it is inserted on the medial side of tibia. Then is the iliopsoas. The iliacus origins from the iliac crest and iliac fossa, and it is inserted on the lesser trochanter of femur here. The psoas muscle, psoas major and minor. The major muscle comes from the vertebrae T12, L1, L2, L3, L4, and L5, and it goes to be inserted on the lesser trochanter of femur. And the psoas minor comes from the vertebrae T12 and L1 only, and it is also inserted on the lesser trochanter. So iliopsoas as a whole get inserted on the lesser trochanter of femur. Then is the pectineus. Pectineus comes from the superior ramus of the pubis, and it is inserted on the pectineal line on the femur. Then are the quadriceps femoris muscles. The first one is rectus femoris. It has two heads. One is the straight head and one is the reflected head. And both these arise from the anterior inferior iliac spine and a groove over the acetabulum. And insertion is common, that I'm going to tell you in the end. Then the vastus medialis. The vastus medialis muscle comes from the lower part of the intertrochanteric line. This is, where is vastus medialis? This one. This red line is the vastus medialis. It has a long origin. Starting from the lower part of the intertrochanteric line, then it goes on the spiral line, comes on the backside of the femur, on the medial lip of linea aspera, and finally on the medial supracondylar line. Then talking about the vastus lateralis, it starts from the upper part of the intertrochanteric line, goes back on the lateral lip of the linea aspera. And the vastus intermedius, it is attached here. You can see this reddish attachment is of vastus intermedius. It is attached on the anterior and lateral sides of the upper 3/4 of the femur. And all of these, the three vasti and the rectus femoris, they combine together and get inserted on the base of patella here. This is common insertion of the quadriceps femoris muscle. This is patella. Patella is a triangular bone having an apex here and a base above. So all these muscles, the quadriceps femori, they are attached on the base of patella. All these muscles are supplied by the femoral nerve, and the action of these muscles is such that the sartorius, iliacus, psoas, and pectineus, they are the flexors of hip, and the quadriceps femoris, these are the extensors of knee. So this group is flexors of hip and this group is extensors of knee. Then we are going to discuss the femoral triangle. What is femoral triangle? It is a triangular area below the inguinal ligament. This is the area of the inguinal ligament. And it lies on the upper 1/3 of the anteromedial side of the thigh. It has various boundaries. Look at this picture. The base of this triangle is formed by the inguinal ligament. The lateral boundary is formed by the medial border of sartorius, and the medial boundary is formed by the medial border of adductor longus. This is adductor longus. It is forming the medial boundary of the femoral triangle. The roof of this triangle is formed by superficial skin, superficial fascia, and deep fascia. And the floor is formed by various muscles. Coming from the lateral side to the medial side, we have iliopsoas, the iliacus, psoas, then the pectineus, and partly the adductor longus. So these are the various muscles forming floor of the femoral triangle. Now let's discuss the contents of the femoral triangle. Femoral triangle has femoral nerve, femoral artery, femoral vein, few lymph nodes. In addition to these, we have a femoral branch of the genitofemoral nerve supplying this pectineus muscle. And in this picture, we can very clearly see the boundaries as again. The base is formed by inguinal ligament, lateral boundary by sartorius, medial boundary by adductor longus, floor by pectineus, adductor longus, iliacus, and psoas. Here you can see the iliopsoas. Apex is the point where these two boundaries meet, and this the sartorius and the adductor longus cross at the level of apex of femoral triangle. In this picture, we can very clearly see the contents again: the femoral vein, femoral artery, femoral nerve. Lateral cutaneous nerve is also one of the contents. Here we can see that the femoral vessels are surrounded by a whitish sheath that is called the femoral sheath. This structure is the femoral sheath. Femoral sheath is formed by, the anterior wall is formed by fascia transversalis and the posterior wall is formed by fascia iliaca. And it is compartmentalized. It has three compartments: a lateral compartment, an intermediate compartment, and a medial compartment. The lateral compartment has femoral artery, medial compartment has femoral vein, and the medial most compartment has just a lymph node. And this medial compartment is also called the femoral canal. This green structure is the femoral triangle. At the level of apex of triangle, it continues down into another canal that is called the adductor canal. We are going to discuss this in some another class. So this is the femoral triangle having boundaries as I've told you earlier, and this extension is the adductor canal. Contents of femoral triangle I've told you earlier. Now let's discuss briefly the femoral artery. Femoral artery is the artery of supply of the anterior compartment of thigh. It is continuation of the external iliac artery, enters the thigh behind the inguinal ligament, enters the femoral triangle. On the medial side, it is bounded by femoral vein, and on the lateral side, it is bounded by femoral nerve. Then it goes down at the level of apex of femoral triangle. It enters the adductor canal. Firstly, it passes between the adductor longus and adductor brevis muscles. Further down, it is passing between adductor magnus and adductor longus muscle. Then it enters through an opening in the adductor magnus and continues down as popliteal artery behind the knee. Here, this is femoral artery going down and continuing as popliteal artery behind the knee or in the popliteal fossa. Then is the femoral vein. The femoral vein has various tributaries. The various tributaries are the profunda femoris vein, the great saphenous vein, and other corresponding branches of the corresponding veins of the arteries of the anterior compartment of thigh. This is the femoral sheath. The femoral sheath has three compartments I've mentioned earlier. It has a lateral compartment having femoral artery and the femoral branch of genitofemoral nerve, then a medial intermediate compartment containing the femoral vein, and the medialmost compartment containing the lymph node of Cloquet or the lymph node of Rosenmuller. The boundary of the femoral sheath is called the femoral ring. This medialmost compartment of the femoral sheath is called the femoral canal, having the lymph node of Cloquet. This boundary is formed by lacunar ligament. The medial boundary of the femoral canal is formed by lacunar ligament, and the lateral boundary is formed by the septum that is separating it with the from the femoral vein. Femoral pulse can be palpated at the level of mid-inguinal point. Just behind the inguinal ligament, it is a point midway between the pubic symphysis and the anterior superior iliac spine. What is the significance of femoral canal? A femoral hernia can occur here. What is femoral hernia? It is herniation of abdominal contents. If there is weakening of abdominal wall, the hernia or the bowel loops, they pass down through the femoral ring into the femoral canal, and then finally through it moves anteriorly through the saphenous opening. So reduction of the femoral hernia is in the opposite direction. That is, the doctor reduces it first backwards and then upwards through the femoral canal, through the femoral ring into the abdomen back.